One of the things that happened with hydrotherm is, in the very early days, we almost didn't realize what we'd invented. And then little by little, particular sectors of, well-being and health kind of, came to us and go, oh, this would be really great for this. And then we would collaborate with them and maybe design something. So that happened with the use of hydrotherm during pregnancy massage, where we don't side lie the client. We have a client at like a 30-degree angle, which again is more comfortable for the client, but still lets the therapist be able to do an actual full body massage to the whole back to get to the back of the legs and the
When you
glutes.
say 30 degrees, what do you mean?
So if you imagine your standard massage table would have a back section that can incline.
Yes.
So we would, as the client gets onto the massage table, we would lift the table up as they lay back. So they're never laying completely flat.
Right.
So post 6 months, I think, is the normal advice from midwives and from the obstetrics industry. You wouldn't want to have a client laying completely flat. Some pregnant women are comfortable that way, but the advice is to avoid the baby coming up into the diaphragm and pressing on the descending aorta. So having them inclined means the gravity naturally has the baby come down into the lower abdomen. You can still massage that area and you can still get to the lower back and the shoulders. And a lot of my pregnant clients have said, and I've got some YouTube videos of people who are very heavily pregnant talking about their treatment afterwards and just saying how the only place they really felt comfortable, they couldn't really get comfortable in their own bed even, was lying on the water, being warm, being supported. And in places where I've worked with hydrotherm and they have, specifically marketed the pregnancy aspect of things, 15 to 20% of my clients on a regular basis would be mums-to-be. So
and that's where it's been really popular for us. Is in with pregnancy massage.
Yeah, but obviously once someone's had the baby, then they're nursing and they don't want to lay face down.
Yeah.
And actually, once they've got used to the benefits of hydrotherm, although we didn't design it as to be better, that's the feedback that we got from a lot of clients. Once you've eliminated those issues of turning over face holes and what have you, clients don't really want to go back to that. So you kind of capture a client when they have a specialization like pregnancy massage, and then you keep them. So,
I can also remember in the early days as well, one of the issues that we had, because if you put too much water in, then it can get like a little bit like a rocky boat kind of thing. Yeah. So it's which is obviously what you teach, how to have it sort of filled just to the right amount.
We've all done it. I've done it where I've rushed in, I've had 5 minutes to set up, I put too much water on it, in it. And then what you actually want ideally is the client to lay in almost like a U shape of water.
Yeah.
So they've got a little bit of cushioning on the side, and then as they would move naturally, that cushioning would have them feel more stable.
It's like cocooning them a little bit, isn't it?
Exactly.
Yes.
But you've always got enough underneath so that the therapist doesn't have to lift them up. And occasionally we'd find that a therapist, instead of someone being trained by someone who's trained to teach, they might be shown how to use it by another therapist, and they wouldn't necessarily adjust the nuances of that, like how much water to put in or, how to position someone correctly. But, equally, if you haven't got enough time to set up, you don't do it properly, that can happen. And, it's not funny at the time, but afterwards, like there's lots of stories of, I've never had anybody fall off the bed, but, you can see people kind of listing to one side a bit like a boat. So, but when you get it right, it's amazing.
And how many establishments would you say in the UK?
That's a very good question. And it's difficult for us to keep track of it because the amount therapists move through organizations, once a spa or a salon doesn't have a qualified therapist, effectively they can't offer hydrotherm. So I know there have been hundreds, like even just the ones that I've worked with. And as I said, from health hydros, right the way, through to 5-star hotels in London, some of the top day spas, and right the way through to individual therapists, working from home. So I talk more about the cross section of different kinds of therapists rather than the numbers.
Yeah.
But I do feel like we've only really scratched the surface.
I was going to say, it's a little bit like the best kept secret still,
It
isn't it?
is a little bit. And there's something I'm very passionate about changing, which is one of the reasons why I wanted to come on the show.
Yeah.
You know, I use hydrotherapy in a very specific way because my specializations have gone more into the holistic understanding of massage and mindset and how emotions show up in the body. But I also have worked with professional sports people. From my football background, I've worked with professional footballers. I went into Tottenham Hotspurs and worked with their team, their sports science team. I've seen the benefits that professional athletes get from having massage on the system. But I've also worked, for example, with the Royal Surrey Hospital in Guildford in their oncology ward, training volunteers to be able to teach massage for clients with cancer. And that was before we designed our own course, which trains therapists in how to safely and effectively adapt their massage to be able to work with cancer patients. Because as you say, most cancers affect the front of the body. So once people have had surgery or they've had adaptations, like if they've got a colostomy bag or an ileostomy bag, then lying someone face down really isn't an option.
No.
But being able to give therapeutic touch is what we would say. So not affecting the cancer, but not having the treatment be affected by the client's surgery is the key thing for us. We've developed protocols in that regard as well, and worked, I've worked with quite a lot of clients who wouldn't have been able to have massage otherwise.